and I am thrilled to introduce tonight's speaker, Dr. John Chuck. Unprecedented burnout has separated healers from their meaning and purpose and threatens to erode the foundation of our healthcare system. This presentation invites participants to take a fresh look at why and how they do their work as individuals and as members of teams. Dr. Chuck explores with the audience a promising new construct that features servant leadership, the adoption of resilience-promoting habits, and a long overdue emotional reconnect with the stories that first called us into the healing professions. Dr. Chuck is a family physician and the former regional chairperson of the Physician Health and Wellness Leaders Group for the Permanente Medical Group. He recently launched a wellness consulting service that focuses on the unique challenges faced by healthcare professionals and in the organizations they work for. His areas of interest include mental health, values congruent living, and resilience training. He is a graduate of UC Berkeley and the UCLA School of Medicine and did his family medicine residency at the UC Davis Medical Center. John is the founder and CEO of Serotonin Surge Charities, a 501c3 nonprofit organization that raises money for safety net medical clinics, a senior fellow of the American Leadership Forum, and a UC Davis Foundation trustee emeritus. To everyone tuning in, Dr. Chuck.
Thank you, Nick, for that very kind introduction. And also thank you for your generous support of my favorite medical society in the world. I love what SSVMS is doing for all the physicians in our community. And I want to thank Sam and Lindsay in particular for getting this evening's virtual wellness programming together for all of us. And welcome to everybody who has tuned in this evening. I know that you've all had very busy days, even the retired physicians, of whom I am one now. You know, people who are retired often say, I don't know how I worked when I was working. There's so much to do every day. And I find that to be true also. All right, so let me share my screen here and get started. So I'd like to share with you this evening a story of joy and meaning in medicine. This is part 1 of 2. The nice thing about having a part 1 and 2 is wherever I stop this evening is where we'll pick up next Tuesday evening. So I have zero pressure to quote unquote finish on time as I usually do. It's great to be here. I really cannot overstate what a fan I am of our local medical society and the groundbreaking work it's doing in creating inclusive wellness programming for all physicians in our region. I really think it's the best medical society sponsored comprehensive wellness program in the nation. And I always speak very highly of it to audiences all over the country. It really is amazing the work they are doing. So thank you all for your generous support and membership in the medical society. If you're not a member yet, please participate to the best of your abilities. All right. So I have nothing to disclose. I would like to start off with an evening stretch. This is my favorite stretch from the great Rachel Remin, who has helped many physicians and healthcare professionals find joy and meaning in their careers. And so if you can follow along with me at home, first of all, reach up in the air and reconnect with all the things in life that inspire you. And then lean forward and reach down to your feet just to remind yourself of the foundations of your life and the principles and beliefs and goals and visions that hold you up. And then put your arms out to your side and pretend you're physically touching the people with whom you do this very important work in the healing professions. And finally, bring your hands into your heart and make a commitment to reconnect in with your values and your purpose for living. I was voted the most optimistic graduating senior at Lowell High School in San Francisco, class of 1978, 850 people. And for some reason, they thought I was the most optimistic. But after over 3 decades of medical practice and living my own life, I've realized that life can be difficult, at least as difficult as this poor cow stuck on a fence. And we have this predicament in life, which is our suffering and mortality. And we spend much of our life trying to figure out the means of its resolution. And we find ourselves asking ourselves important questions like, what on earth am I here for? And why do I feel this way I feel? And where do I belong? Like who's my posse? Who's my tribe? And what is my purpose? the brevity of life. We are reminded of the brevity of life every day. My neighbor is dying of cancer, and when he sent out an email to the neighborhood, family, and friends, in the subject line, he had this quote from Isaac Watts. These are the lyrics to a hymn, and it says, "Time, like an ever-rolling stream, bears all her sons away. They fly forgotten as a dream dies at the opening day." And once again, this is just a reference to the brevity of life, and all of us in healthcare understand this concept well. So we have this predicament, and we're trying to figure out the means of its resolution. And the current pandemic has not helped one bit to make us feel any better. So basically, the big elephant in the room is COVID-19, and the elephant is taking a big COVID-19 dump on us. And this has resulted in a lot of grief and despair that was very well described by Dr. Yellowlees last week. I hope you all had the opportunity to tune in and hear his excellent talk. But basically, there are many stages of grief, which include the loss of normalcy, the fear of economic toll, the loss of connection, the loss of safety, both on the microscopic germ level, but also just the macroscopic societal level. I mean, especially when we see all the civil unrest and the anarchy associated with many of the recent protests. And so it's a difficult time, to say the least. On the left, you'll see a diagram of all the things that healthcare professionals were already dealing with. You know, time pressures, a chaotic environment, the electronic medical record, low control of the pace of your work. And of course, you all have lives outside of medicine. And then we've added on top of that COVID and the needs to practice in a completely different way. And I don't know about you, but I'm also mourning the loss of civility. I guess I would hope that during the most difficult times in our lives that we would really come together and collaborate for the greater good. But I think it's just normal that oftentimes in times like this, when we face great challenges, there's a loss of civility. And so we add that to our grief. Here's a little cartoon that I pasted together. Before COVID, also known as BC, there were people who were optimists, where everything is half full, and then there are the pessimists, where the glass is always half empty. But after COVID, everybody says, oh, this is just piss. The glass is not half empty or full, but whatever's in there is piss. This is a picture of the great Robert Bergelman, who's a professor at the Graduate School of Business at Stanford. And I once heard an excellent 4-hour presentation by Dr. Bergelman about strategy and winning. And I'm going to save you some time here and summarize 4 hours into 1 minute. And basically what Dr. Bergelman said was, strategy is the art and the science of having what it takes and doing what you say. And when you're facing great challenges like professional disengagement or burnout, or how to meet the challenge of COVID-19, you have to have a strategy. So the Heath brothers wrote an excellent book called Switch, How to Change Things When Change is Hard. And what they argue is that individuals and societies have always faced great challenges. I mean, healthcare providers right now are facing issues of burnout and COVID, but we've always faced great challenges as human beings. And the Heath brothers observed through their research that there are always some individuals and groups that are responding better to the challenges, and they call those people and those groups bright spots. And one of our responsibilities as leaders in society to help pull ourselves and others through this morass is to either be a bright spot of positive adaptation and innovation, or to at least be aware of the bright spots and to adopt those habits and changes for ourselves and our organizations. So I'm here to tell you a story of joy and meaning in medicine. And I'm telling a story because people remember stories. You know, stories are like facts embellished with a plot and heroes and villains, and you can remember things when it's told in the form of a story. And my story has 3 parts. And part 1 is titled A New Direction. And it's talking about how these difficult times have really forced us to take a new direction in medicine, one that's very positive for us and points to a bright future. Chapter 2 is, the title of chapters 2 and 3 are based on the work of psychologist Jonathan Haidt at NYU. And he talks about the metaphor of the rider and the elephant with regards to how humans think and act. And the rider refers to our cognition and higher levels of thought, and the elephant refers to our emotions. So chapter 2 of this story of joy and meaning in medicine is called Chit Chat with a Little Man, which is the rider. And then chapter 3 is Playtime with the Elephant. And we'll be playing with the elephant and our emotions that drive us next Tuesday evening. Chapter 1 is a new direction. So basically, the relentless pursuit of perfection in American medicine, it's had some unintended consequences. Like, nobody wanted these things to happen, but they've definitely happened. So the triple aim was an initiative to simultaneously increase quality outcomes, patient satisfaction, and reduce costs. And this triple aim was coupled with granular metrics. And also, while trying to achieve the triple aim and being measured for it, we were facing what I call multiple simultaneous conflicting imperatives. The acronym is MSCI, and it's pronounced messy. And for the visual learners out there, this is an image of what it means to be pulled in multiple different directions at the same time. There's my son in the middle being pulled in one direction by his mother saying, please marry a young woman and make me a grandmother. And then there's me on the far end. I always thought my son would be a great physician, so I gently nudged him towards medicine. He declined politely, actually not so politely. And then there's his little sister. They're all much older now, but I like this old picture. And she was saying what all little sisters say to big brothers, which is, I hate you, I wish you had never been born. And you can certainly all understand how messy our lives are, how in any given day we're pulled in multiple different professional and personal directions, and it's all happening at the same time, and everything is absolutely imperative. And of course, there have been well-known and well-published and distributed studies documenting the disengagement and burnout among physicians in America. And the overall numbers are not good. And burnout peaked at 54% in the 2014 survey, down to 44% in 2017. But depression was up to 42% in 2017. And the interesting thing about these numbers, I think that one of the best analyses I've heard of these sorts of numbers is that if it's affecting almost half of American physicians, the problem is not the individual. It's the system that's putting us in some very difficult situations. For those of you who need data before you believe that burnout reduces quality and safety, there's plenty of data. You can email me at johnchuck1@gmail.com, and I'll send you a whole folder full of PDF files. But it makes intuitive sense to me that those of us who are disengaged and burned out, of course, we'd provide inferior care. This is a little diagram showing that somebody who's well on the left here can produce supreme performance in whatever arena, be it no nosocomial infections, the efficient use of EMR, supply chain things, quality reports. But if you're on the right side of the screen and you're burned out, you're just in no position to contribute to supreme performance. And we need people on the left side of this burnout wall. Well, many very smart individuals and organizations began to study in rigorous ways physician and healthcare provider disengagement and burnout. And the good news is that after putting much thought into it and applying extreme academic rigor, groups like the IHI decided that at the core of the new direction of medicine must be happy, healthy, productive people. And that's good news for us because we are the people providing the care. Stanford produced the diagram on the left talking about the 3 reciprocal domains of wellness, which are having a culture of wellness, efficiency of practice, and personal resilience. And then I've expanded on that to include some of the granular elements of culture, practice, support, and personal resilience. I'd like to talk a little bit about joy and meaning. I had the honor of attending a lecture at UC Davis a year or 2 ago, and the speaker was Doug Abrams, the tall gentleman in the middle, who wrote the Book of Joy. And the Book of Joy was written based on 5 days that Doug Abrams spent with Bishop Desmond Tutu and the Dalai Lama. And Doug addressed the audience, very engaging speaker, and he said, you know, maybe some of you here have read my book, but many of you may not have the opportunity. Let me just condense it for you. He says, basically, joy is a choice, and it's inseparable from suffering. You know, it's just 2 sides of the same coin, and that coin is called life. And he said the greatest joy is to bring joy to others, which in healthcare we would call compassion and active empathy. And it's possible to bring this joy to others regardless of whether you have joy yourself. And just a few comments about meaning. I had the pleasure of attending a 2.5-day seminar in Yellow Springs, Ohio with Rachel Remin, who is the goddess, the queen, the knower of all things about meaning in medicine. And Dr. Remin said that meaning is the deep satisfaction of knowing that your existence matters and that what you do makes a positive difference in the lives of others. And I think this is great news for those of us who are like that cow sitting on the fence asking, you know, what is life about? What am I here for? What's the source of my joy and meaning? So I just love this definition that Dr. Remin has of meaning. I just want to point out that at least within the organization I recently retired from, the progress in joy and meaning in medicine is iterative, and it has not yet reached its full potential, although it has shown much promise, just like the Los Angeles Rams did when they got a new coach and a young new quarterback, and they made it to the Super Bowl a couple of years ago, only to be shellacked by the gold standard in football, which at the time was the New England Patriots. And the New England Patriots are analogous to quality, service, access, and cost in the healthcare world. And joy and meaning, it's like the Los Angeles Rams. It shows great promise, but we have much more to achieve and to do. All right, so that is the new direction. We have a lot of disengagement. We have a lot of burnout. It's been documented. And the new direction is that we need the people doing the work to be fully engaged in the work. We need to be asking them what's important to them. We need to be asking them what are the pebbles in your shoes that are preventing you from doing your best work. And next Tuesday evening, I'll be talking in depth about the type of leadership, namely servant leadership, that we need to lead us in this new direction. All right, on to chapter 2, Chit Chat with a Little Man. That's the little man on top of the elephant there. Many of you who know me well and have heard me speak know that in junior high and high school, I took French for 5 years. Why I took French for 5 years, I have no idea. When you grow up in San Francisco, you don't know that a lot of people in California speak Spanish, so I took French. And when you take French, you read a lot of French literature, which is very depressing. People like Jean-Paul Sartre saying, you know, life is short and then you die. All you know for sure is that you're going to die. And you know, there's him on one end of the spectrum, and then there's me on the other end, voted the most optimistic graduating senior in my high school class. But if there's one thing that Sartre and John Chuck completely agree upon, it is that the choices that we make in life determine our destiny. So what I would like to do now is to offer some suggestions about adaptive choices that I think you can make to have more joy and meaning and be more engaged and be more well during this time. So what is the context in which we make choices? It's important to know not only the facts, but the context of them. So this slide which includes some work done by the Israeli sociologist Antonovsky and a quote from Viktor Frankl, the author of Man's Search for Meaning, demonstrates that in life, on the spectrum of health in life, you have good health on the right and bad health on the left. And in that spectrum, we have many stressors. And these stressors produce tension, but the tension in our lives is not the source of our disengagement and burnout and unhappiness. It's making a maladaptive decision about what to do in the space in the wake of the tension. So what Viktor Frankl said was, between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. So to make this applicable to the current day, I mean, the pre-existing stressor was that a career in medicine is very difficult. Multiple simultaneous conflicting imperatives. A lot of people want a lot of things from you at the same time. You don't have a lot of control over many things. And then you dogpile on top of that COVID-19. So of course this produces tension. But the important thing is to be very mindful, to be present in the moment of that tension, unfettered by regrets about the past or anxiety about the future, and to just be present and just take a step back and make a good decision about how you will respond to this tension. And in that response, as Dr. Frankl says, lies our growth and our freedom. The mindset that we have when making these decisions and thinking about the context of our life is very important. And this was this was illustrated well by Dr. Kelly McGonigal, a health psychologist, who looked at a very large database of almost a couple 100 million people over 8 or 9 years. And what she found is that of the people surveyed, if they checked a box saying that they had a stressful life, and they also checked the box saying that a stressful life leads to bad health outcomes, those people during the study period had a 43% increased risk of premature death. However, if you check the box saying that you have a stressful life, but you don't believe that stress leads to bad health outcomes, you had a 0% increased risk of premature death during the study period. And so the synopsis of that would be that if you come to work every day saying, this job is going to kill me, it's going to kill you. But if you come to work every day saying, wow, a lot of stressors here, a lot of tension, but I can adapt to this in a way that will help me get through it, you'll do much better. So these are the choices that I'm recommending you make on the menu of life. And we'll go over each one in detail. Number 1, slow down and spend more time in the sweet spot. Number 2, be grateful. Number 3, embrace lofty values and goals. Number 4, keep your body moving. Number 5, adapt to change and suffering and emerge a better person. Next, invest in relationships. And finally, forgive yourself and others for being less than perfect. And this is the primary stumbling block for most healthcare professionals, and we'll talk about why. So this is a picture of Dr. Christine Carter from UC Berkeley and Dr. Alan Jung, who hosted a regional teleconference for my medical group. Dr. Carter wrote a book called The Sweet Spot: How to Find Your Groove at Home and at Work. And knowing that she was addressing a very hyper busy audience, her recommendation was to dial back busyness and to dial up strategic slacking, which most of you have probably never done. Like, who does strategic slacking? Well, people who are well do strategic slacking. So basically, on the spectrum of human behavior, we have the hyper obsessive compulsive people on the left, who are all about accomplishment. That is all of you who have tuned into this evening wellness conference. That's how you got to where you are today. And then on the other end of the spectrum are those people who are completely at ease with everything. They're mostly unemployed. But there's a sweet spot in the middle, which is kind of a balance between being at ease and being overly obsessive compulsive. And that's where we want to be. I like to say that the drive to succeed is like Brill cream, just a little dab will do you. I'm 60 years old, so I know what Brill cream is, but if you don't know, it's a petroleum product that's used to grease down your hair and make it look good. And when I was growing up, their slogan was, a little dab will do ya. It's not like 60 grams applied 3 times a day. It's just like a gram every other day, and that's plenty. And the same is true for our obsessive compulsive behavior. You want to be just motivated enough to get things done, but not enough to drive you crazy. Recommendation number 2 is to choose gratitude. And this is a picture of the great Bob Emmons, who many of you have heard speak before, but he is a professor of positive psychology at UC Davis and has done some monumental groundbreaking work in the effects of gratitude journaling on our happiness. And basically, Bob has demonstrated over and over again in multiple subject groups that those of us who start out each day by gratitude journaling, just literally writing down in a journal 3 things we're grateful for, and it can't be something from yesterday because that's lazy. If you do that 21 days in a row, he's shown over and over again that compared to control groups that do not start out with gratitude every day, you have better health outcomes, better mood scores, and the family and friend perception of you is improved. I summarize Bob's works by saying it's like making the transition from waking up every day and saying, woe is me, which is what many of us do in life, despite the many blessings in our life, and instead waking up and saying, wow is me, just being grateful that you even woke up and that you're blessed with one more day of meaningful work and the strength to do it. It's also very important to know not to compare yourself to the very few people in life who have it better than you, but rather to the masses who are less fortunate. And this is a common fault of many people, but definitely including healthcare professionals. You know, we all want to focus on the very few people who have more opportunities, better family lives, more glamorous lives, when in reality, if you step back and look at the world's population, we are some of the most blessed people in the world. And many times the predicaments that we find ourselves in are things that we've chosen for ourselves. So what I'd like to do right now is everybody on the call, I would like you to take a minute to text someone a message of gratitude. So it's obviously somebody who has to be on your smartphone, but think of somebody that you're really grateful for and text them a message saying, I just want to let you know that I'm thankful for, and I'm going to do it right now myself too. I'm going to text my sister Carol, who's just the nicest person I know. Carol Jensen, just want to thank you for being the most unconditionally kind and loving person in the world. And then I'm going to put the picture of the planet. Send. Okay. Isn't that fabulous? So a whole bunch of messages of gratitude just went out. Normally when I lead this live, you know, you pair up with somebody, but this is like the way we do it now during a pandemic. Okay, next, choose lofty values and goals. Dream big, you know. When my daughter graduated from high school, Mr. Williams was the faculty speaker, and he said to the graduates of Davis High, my only hope for you is that at some point in your life, you will work with other people for a cause greater than yourself. And of course, none of the graduating seniors listened. They're all just thinking about themselves and getting drunk and making a lot of money. But as a parent, you know, who's lived a little bit through my own life and my patients' lives, I mean, this was just pure gold. I mean, that actually is what you want to do before you die, is to work with other people for a cause greater than yourself. This is a long but lovely essay by David Brooks in the New York Times, and I'm going to read it to you because it's pure gold. About once a month, I run across a person who radiates an inner light. And don't we all want to be that person, the person that radiates inner light? These people can be in any walk of life. They seem deeply good. They listen well. They make you feel funny and valued. You often catch them looking after other people, and as they do so, their laugh is musical and their manner is infused with gratitude. They're not thinking about what wonderful work they are doing. They're not thinking about themselves at all. When I meet such a person, it brightens my whole day. But I confess I often have a sadder thought. It occurs to me that I've achieved a decent level of career success, but I have not achieved that. I have not achieved that generosity of spirit or that depth of character. I'm sorry, I need to move these little screens around here. Whoops, that's not what I wanted to do. Well, a few years ago, I realized I wanted to be a bit more like those people. But I realized that if I was going to do that, I would have to work harder to save my own soul. I would have to have the sort of moral adventures that produce that kind. I'm sorry. Oh, hang on. Sorry, technical issue here. There we go. I was going to have to be better at balancing my life. It occurred to me that there were two sets of virtues, the resume virtues and the eulogy virtues. The resume virtues are the skills you bring to the marketplace. The eulogy virtues are the ones that are talked about at your funeral, whether you were kind, brave, honest, or faithful. Were you capable of deep love? We all know that the eulogy virtues are more important than the resume ones, but our culture and our educational systems spend more time teaching the skills and strategies you need for career success than the qualities you need to radiate that sort of inner light. Many of us are clearer on how to build an external career than on how to build inner character. But if you live for external achievement, years pass and the deepest parts of you go unexplored and unstructured. You lack a moral vocabulary. It is easy to slip into a self-satisfied moral mediocrity. You grade yourself on a forgiving curve. You figure as long as you are not obviously hurting anybody and people seem to like you, you must be okay. But you live with an unconscious boredom, separated from the deepest meaning of life and the highest moral joys. And gradually, a humiliating gap opens between your actual self and your desired self, between you and those incandescent souls you sometimes meet. All right. Next suggestion, choose movement. So I'd like us to all move a little bit. You know, oftentimes we're stuck at our workstations and you say, I have no time to exercise, but you actually do. So tomorrow, between patients, just do this once, okay? We're gonna do head, shoulders, knees, and toes. And it's great for movement. Here we go, ready? Head, shoulders, knees, and toes, knees and toes. Head, shoulders, knees, and toes, knees and toes. And eyes and ears and mouth and nose. Head, shoulders, knees and toes, knees and toes. Very good, that's fabulous. You know, I know that many of you either do aerobic exercise or just resistance training or just movement and flexibility training. And I would just like to recommend that if possible, that you mix them up and cross train. I've always been very good about hiking and walking and biking, but since I retired, I have reduced that and joined my wife twice a week for bar classes. And it's kicking my butt, but it's helping me to retain range of motion and certain muscle groups that otherwise were just gonna die on me. So choose movement. And movement is magical in the 5 blue zones of the world where people live to the age of 100 at a rate 10 times that of Americans. People naturally move, and it's not by going to health clubs or wearing spandex. Their lives just involve walking to the store, going up and down hills, and doing chores around the house, like this scene from The Karate Kid. It's all about wax on, wax off. So partly to save money, but also just to keep moving. I wash my own car. It's great movement for the body, and it's very satisfying. So consider things like that. Next suggestion, choose to adapt to change and suffering and emerge a better person. You know, so this gets back to the mindfulness slide from Viktor Frankl. So pain and suffering don't always need to make your life worse. In fact, if you lived a little bit, you would know that it's oftentimes through pain and suffering that we emerge a better form of ourself. And there is an art form called kintsugi, where Japanese artists, when a porcelain ceramic would break, instead of throwing it away, they would piece it back together and use gold dust to fill the fracture lines. And there's a picture of this. And kintsugi is a metaphor for our lives and how sometimes it is in our brokenness and our suffering that we forge the best part of ourselves. And the great Elizabeth Kubler-Ross said, the most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These persons have an appreciation, a sensitivity, and an understanding of life that fills them with compassion, gentleness, and a deep loving concern. Beautiful people do not just happen. I am positive that when we emerge from this pandemic, we'll have many battle scars, but many people will emerge as more empathetic, loving, inclusive, sensitive people. And so while I would never wish this calamity on anybody, I do know that at the other end of this dark tunnel is going to be some great light. My next recommendation about choices is to choose to invest in relationships. As Robert Swenson wrote in his book, Restoring Margin to Overloaded Lives, he says, your relationships with others is called your social life, with yourself as your emotional life, with God as your spiritual life. And then I've added with nature, I call that your Grizzly Adams life. And, you know, the verdict is out, and even Harvard University has said that the most important driver of happiness, joy, and meaning is good relationships. It keeps us happier and healthier, far more important than socioeconomic status, zip code of your personal residence, your income. It's good, deep relationships. So if you find yourself somewhat disengaged and lost, think about investing in relationships, because those are going to be the source of your joy and meaning. Once again, from the Blue Zones, in all 5 Blue Zones, there are very well developed social networks. In Okinawa, when you're born, you're placed into what's called a moai, which is your peer group from birth to death. And these are the people with whom you go through education and marriage and child rearing and careers and retirement and disability and death. And these bonds that we form with other people are such an important part of a life well lived. Wayne Sotil, who's a wellness consultant based in the Southeast, said that the quality of personal relationships is one of the most important predictors of resilience. And these are some pictures of my extended families. And we, you know, three out of the 4 parents, grandparents for our children have passed away, but no regrets for many of us, because while they were alive, we regularly invested in these extended family relationships. And then this is my poker group on the lower right-hand corner. And I show this picture because I fell into this group over about 30 years ago. We met through our wives and the firstborn kids. And I continue to be very good friends with them. I actually performed the wedding ceremony for one of the daughters. Although these people are completely unlike me, politically and everything. They're all business people. They're all super conservative. And at one point I thought about removing myself from the group because we're so dissimilar. But my wife admonished me, saying, there's no way you're leaving that group, because if you were only friends with people who are just like you, you would have no friends. And sure enough, I love these guys, even though we disagree about all politics and the upcoming presidential election. But I call them my pallbearer buddies. They've been there for me during difficult times and vice versa. And when I die, they will be the people carrying my ashes or my casket. I'm going to skip this slide. It's 6:50. I'm going to go about 5 more minutes and then take a few questions. But once again, I hope you can join me next week for part 2. So here's a social life bonus tip about choices. Choose to engage in a counseling relationship. It really works. I was not a believer until about 10 years ago. We ran a wellness pilot project at the Davis Medical Offices, and we brought out an EAP counselor, Employee Assistance Program counselor, and all the physicians signed up to do 3 one-hour sessions with her. Her name's Marisa Pierce. And I loved it so much that I continued the relationship until I retired last month. And what I like to say about Marisa, and this is what a session looks like you don't have to lay on a couch or anything. This is just what it looks like. I say, Marisa helps to keep me more right in the head. And who couldn't use a little more clear thinking during a season of burnout and pandemic and wildfires and social unrest? I think it's luxurious. And everybody likes to brag about, their yoga instructor or their vegan, chef coach and stuff. But, when people go to those things, you don't like them anymore. But if they would all go to counseling, you'd like them a lot more. So I think that we should remove the stigma of mental health challenges, and also remove the stigma of seeking professional help to improve our mental health. My last recommendation for a good choice to make is to choose to love yourself and others, warts and all. This is a book by Danielle Ofri, What Doctors Feel. My niece is a surgery resident at UC San Diego now, but when she was a medical student at Davis, they gave them this book and they had them read it. But basically, we feel a lot of things. And one of the things that we frequently feel because of the demands of our career is we feel inadequate and we feel shame. And this leads to a lot of depression. And I think it plays a major role in 300 to 400 of us a year taking our own lives or seriously considering that. So Wayne Sotil, once again, wellness consultant, says, beware of superperson syndrome, which we all are at risk for, and recognize that feelings like guilt, shame, and humiliation, they're just natural in the aftermath of the superperson syndrome, which doesn't really have wiggle room for failure or coming up short. And then it's also important to forgive other people. Don't just forgive yourself, forgive others. There's a Chinese proverb that says, the man who opts for revenge should dig 2 graves. Or Nelson Mandela said, resentment is like drinking poison and hoping your enemies will die. You know, it turns out that all those people that are driving you crazy and you're losing sleep because of them, they have borderline personality disorders and they don't even know that you exist. Meanwhile, they are ruining your lives. So just let it go. Don't just forgive yourself, forgive others, and you'll be happier. I love Brene Brown because she talks about things like vulnerability and shame. And you know she's very popular because she has lots of hits on YouTube. But basically she says that we live in this really vulnerable world, and we try and numb ourselves to it by buying things and eating these really calorific cupcakes from Costco and drinking alcohol and taking drugs. But there's a better way. And Brene Brown calls it wholehearted living, and it starts with a position of self-worth. And you wake up each morning thinking my best effort today will be enough. And then you go to work and you get beat up, as we all do at work. And then you come home and you go to bed believing, yes, I'm imperfect and vulnerable and sometimes afraid, but that doesn't change the truth that I am also brave and worthy of love and belonging. One of my favorite Brene Brown quotes is that the badasses are the people who dare greatly and tell the truth about their experience. So I'm not advising you to not dare greatly or to be a great physician. I'm just advising you to dare greatly, but tell the truth about what the experience is like, because that creates a culture of inclusion and vulnerability and honesty. And that is the culture that breeds joy and meaning in medicine. So I'd like you to all wrap your arms around yourself right now and then sway back and forth. I think I just did something like this in our bar class just to get range of motion. And I want you to repeat after me. I'm smart enough. I'm good enough. And gosh darn it, people like me. All right? You're smart enough, you're good enough, and gosh darn it, people like you. I like you, okay? And if you'd like to hear that in person, call me on my cell, 530-919-9705, and I will tell you that you're a good person. I love this vegan avocado affirmation cartoon. It says, yeah, this avocado is looking in the mirror and it says, yeah, you're fat, but you're a good fat. Okay, well, I am going to stop sharing my screen now and see if anybody has any questions. I'm going to look in the little chat room here. Okay. Oh, Jerry Rogan, the famous Jerry Rogan says, to all panelists, one can change medical careers. I did it 5 times. I love that. That's a positive adaptation, right? All right. So, okay. And from, my treasured colleague, Paul Reynolds. Hi, John. Having peer group is very helpful and supportive, delicate balance. One tries to be a positive influence, yet too much enthusiasm may be perceived as a unicorn belching. Yeah, you know, that's really true. You don't want to come across as naive, but I think one of the reasons, what I tell people is, I'm optimistic, not because I'm naive. I'm optimistic because I've seen the ugly underbelly of life, and I've decided that my response to that is to look for the positive in life. In the one life I have to live, especially as my horizon gets shorter, I believe this even more. So when I was growing up in San Francisco, very modest upbringing, I had friends who fell into gangs. I had friends who were killed. I felt like, you know, the opportunities were not good. You know, if you think growing up in San Francisco is good, it's not, unless you're really wealthy. It's actually very difficult. So my optimism and positivity, I mean, it's partly genetic. The research shows that, but it's also based on the fact that I think life is actually very difficult. And I'm a big believer in mindfulness and just calling out life for what it is, and then making some positive decisions about adaptive behaviors that will help me live my best life. So, but I certainly understand what Paul is saying. Yes, from Dr. Mosquito to all panelists, what do you recommend as an evening practice to wind down from a busy day? What does work for you? Well, I actually think that yoga I actually have a home group Bible study at 7, but if I did not, I would definitely do something like yoga or stretching or meditation, which is coming up in 3 minutes. And let me tell those of you listening in, I have never had a better yoga coach than the great Rajiv Mosquito. I mean, he's an internist. I mean, you know, he's a lifestyle medicine expert. He's a good looking guy, but he is a fabulous, fabulous yoga instructor. In fact, in the bar class, it's good, but they don't recognize my pain because I'm not doing it live. But with Dr. Mosquito, whenever I've done yoga with him and I'm reaching under, I'm lifting up my leg in a way I don't know how to, he'll always say something very gentle like, you might feel like you need to throw up right now. And if you do, you know, just back off a little. So he's the best. So Rajiv, seriously, my answer to your question is something like meditation or yoga on a regular basis, scheduled, not just haphazardly. So when you look after yourself, that's not selfish. It's called a healthy self-interest. And it's a really good thing you do for yourself, your family, and your patients. And I always like to end on time. I only have 2 minutes. I'm going to take one question. Let's see, from the great Ruth Haskins. Nighttime, watching this crazy world through the eyes of Stephen Colbert. Humor works magic. Yeah, humor. There's a science behind humor and what it does. There's actually a science behind, even if you're not feeling good, but you just smile, it releases endorphins. So for many of us, humor is a great source of wellness, especially during difficult times. And then don't take the humor too seriously. Just use it to lighten you up and things. And so thanks for that recommendation, Ruth.